Hi everyone, this is Muhammad and today we are going to speak about the last part of embryology and the whole anatomy inshallah. So the mom sends the blood which contains oxygen to the fetus through the placenta and then through the umbilical vein like here, which contains the highest oxygen in the circulation of the fetus. And then the blood will go through inferior vena cava, through ductus venosus to the right atrium of the heart, and through foramen ovale the blood will go to the left ventricle, and from left ventricle it will go to the aorta and to the aortic arch exactly, where it will go to the head of the baby and the upper limbs. Also, superior vena cava will send the blood to the right atrium and to the right ventricle, which will go to the pulmonary entry, and through ductus arteriosus it will go to the aorta. That's all. You should just know the pathway of the blood, and that's all what you need to know. So at birth, the infant takes its first breath, and his lungs while he is a fetus is like shrinked and full of water, so there is no air, so it's only shrinked and full of water like this balloon as we can see. So with the first inspiration we fill the lung or the balloon with like air, and this will expand the lung. Also the pulmonary vessels will be expanded and opened, and this will decrease the pressure from on the pulmonary trunk. Also oxygenation will begin. This will decrease the resistance on pulmonary vasculature. Also it will increase left atrial pressure. Why left atrial pressure will be increased? So here is the left atrium. The pressure comes from the blood inside it. So first of all, the pressure will go through will increase because the blood that comes from pulmonary vein will increase. Why? Because the lung is opened, and when the lung is opened, so it will take the blood from the right ventricle and it will oxygenate this blood and send it back to the right atrium through the pulmonary vein. So increased number of blood here will increase the pressure in the left atrium, sorry. And on the other hand, the right atrium pressure will decrease. Why? Because simply the umbilical vein, which was supplying the right atrium with blood from the mom, will be closed. So the closure of umbilical vein will decrease the amount of blood, so it will decrease the pressure. This pressure, increase of pressure here and decrease here, will close the foramen ovale, because like foramen ovale is like this, so the blood is going like this, pushing it into open. But if there is no need, if the pressure here is higher, so it will pressure this part into this, and it will be like this, so it will close it, forming fossa ovalis. That's how the foramen ovale is closed, by the increase in left atrial pressure and the decrease in right atrial pressure. Also with oxygenation, like when the baby breathes, the oxygen will increase, and this oxygen increase will decrease prostaglandins, and also prostaglandins from the placenta will be decreased because the placenta produce also prostaglandins, and this decrease in prostaglandins will close the ductus arteriosus. The ductus arteriosus is the place between aorta and pulmonary artery. So closure of ductus arteriosus depend on the increase of prostaglandins. What if this ductus arteriosus is not closed? So simply doctor will give non-steroidal anti-inflammatory drugs like indomethacin or ibuprofen, and this will help in closing it. Why do we need to close the ductus arteriosus? Because simply it wastes the blood with oxygen. Because of this is the aorta, which should transfer the oxygenated blood to the body, and this is the pulmonary vein, which should take the blood with no oxygen to the lung to take more oxygen. So the pressure here is much more higher because the pressure in the right atrium is higher, and also because left ventricle muscles are more strong. So if the pressure here is higher and there is a truncus arteriosus, so the blood will not only go to the body but will also go like this because it will push through here. So we are wasting blood holding or carrying oxygen, and this is like a waste. So the ductus arteriosus should be closed by using non-steroidal anti-inflammatory drugs like indomethacin and ibuprofen. Also, that's the fetal postnatal derivatives like ductus arteriosus will be ligamentum arteriosum, ductus venosus will be ligamentum venosus, foramen ovale will be fossa ovalis, allantois will be allantois or uricus will be the median umbilical ligament, umbilical arteries will be the medial umbilical arteries, and as you can see allantois there is an, so median an, umbilical medial, umbilical vein will be ligamentum teres hepatis or like round ligament. Anatomy of heart is very, very, very high yield part. So what we should know, first of all, that we will start by this photo here. So we have the right ventricle. If you see, this is like the front and this is the back. In the front we have right ventricle taking the whole space alone. So if there is a question when someone is stabbing someone, or like someone has like an accident while driving the car and something goes inside his body, so what should we expect to be injured? We will say directly right ventricle. That's what you should really know, that the first thing to be injured in any accident or stab or whatever in the heart, it will be right ventricle because it's the most superficial part. And if there is any problem with the left atrium, is the most posterior part of the heart, enlargement of the left atrium can do some pressure, can do compression on the esophagus, and also it can affect the left recurrent laryngeal nerve, which is a branch of vagus nerve, causing hoarseness of voice, and that's what we call Ortner syndrome. So what we should know is the right ventricle is the most anterior part, and it faces all the problems like stabs, crashes, and left atrium, when enlarged, it presses the esophagus and the left recurrent laryngeal nerve. Okay. Also, this is a photo of the normal heart. This is like normal heart. You should know it because you will see photos for abnormal heart like here. See how it's very big, and see this is like normal heart in the left, no dextrocardia, no enlargement, nothing not normal. The second important thing is pericardium. Pericardium is like the thing covering the heart. It's like formed of fibrous parietal epicardium. What's the most important part? The pericardial space is a really important part because this pericardial space has a fluid. This fluid like insulates the heart sound a little bit, But if this fluid increase due to any reason, like in pericardial effusion, like if there is a pericarditis and it causes pericardial effusion, this will cause muffled heart sound, and also it will cause enlarged cardiac silhouette on chest X-ray, like this photo. This is pericardial effusion. Pericardial effusions happens slowly and it needs time. There is something else called cardiac tamponade. Cardiac tamponade is the filling of the pericardial space with fluid, but this filling is rapid filling, and this fluid will compress the heart. So this compression will cause hypertension, it will cause hypotension, jugular venous distension, and muffled heart sound. So as I said before, the fluid insulates the heart sounds. So if there is a lot of fluid, this will cause muffled heart sound. And jugular venous distensions happen because like if jugular venous distension happen because this like pericardium is not very flexible. So if there is a lot of water here, it will not allow the heart to like expand. So if the heart cannot expand, it cannot add more water. So the water coming from the superior vena cava or the inferior vena cava cannot go to the right atrium. So this will cause the fluid to accumulate in the jugular veins, causing jugular venous distension and hypotension, because the fluid which go here, like in the right atrium, is less. So the fluid which go to the right ventricle is less, and the fluid which goes to the left atrium is less, and the fluid which go to the left ventricle is less. So that means the fluid which go to the aorta is less, and that will decrease the cardiac output, which cause hypotension. So that's the reasons of Beck's triad. So what is Beck's triad? Beck's triad is hypotension, jugular venous distension, and muffled heart sound. And Beck's triad are are the hallmark and the triad of cardiac tamponade. Also, there is another hallmark of cardiac tamponade, which is pulsus paradox. So pulsus paradox is abnormal decrease in the blood pressure during inspiration more than the normal physiologic drop. So during inspiration, there is a normal physiologic drop in the blood pressure, which is less than 10 millimeter. But if there is a pulsus paradox, it will be more than 10 millimeter. How does this happen? So when inspiration happens, when you inspire, you fill your lung with air, and this will increase the venous return to the lung, because your lung will expand, so it will take more fluids, so it will take more venous return. Okay, so this will increase in the right ventricular filling, right? This will increase the right ventricular filling, and the right ventricular can't expand because there is a cardiac tamponade around the heart. So the right ventricle will compress against the left ventricle, so it will bulge into the left ventricle, which will decrease the left ventricular filling, and this will decrease systolic blood pressure more than 10 millimeter. So as I said, pulsus paradox is a hallmark of diagnosing cardiac tamponade. Also, cardiac tamponade is an emergency. Like pericardial effusion is not an emergency, cardiac tamponade is an emergency. Pericarditis is like inflammation of the pericardium. This causes sharp chest pain, left shoulder pain, and referred pain to the neck, because pericardium is like innervated by the phrenic nerve. Pericarditis also often causes effusion. Remember I said one of the reasons of pericardial effusion is like pericarditis. Also, pericarditis on EKG is diffuse ST elevation, as we can see in this photo. Like this is ST elevation. Hemopericardium is the same thing as cardiac tamponade, like rapid filling of the pericardial space, but instead of water or fluid, there is blood. So it's the same signs of cardiac tamponade plus the history of recent trauma or like the history of recent myocardial infarction. I would say why myocardial infarction, because myocardial infarction can cause like rupture of the cardiac muscles, like cardiac muscle can rupture and then the blood from the heart can go to the pericardium. That's the reason of hemipericardium, like either trauma or myocardial infarction. Coronary artery territories and case structures. Artery supplies and clinical significance. So coronary artery, like heart, supplies all the body with the blood, and coronary artery are the blood supply to the heart. It's a lot of arteries, but we will focus on three main arteries: left anterior descending, posterior descending artery, and right coronary artery. Left anterior descending, first of all, it's the most commonly occluded artery in myocardial infarction. The most common occluded artery in myocardial infarction. Left anterior descending artery supplies, first of all, it's anterior. So it supplies the anterior to cerdes, like if this is a heart and this is like the ventricular septum. So it supplies the anterior to cerdes of the interventricular septum. Also it's left, so it supplies anterior surface of left ventricle. And it supplies the anterior, it's left, it's not like in the middle, so it supplies the anterolateral papillary muscle. So just keep this draw in your head, like anterior to cerdes of the interventricular septum, anterior surface of the left ventricle, and left lateral and anterolateral papillary muscles, anterolateral papillary muscles. PDA, posterior descending artery, is posterior, so it supplies posterior third of the septum, posterior walls of both ventricles, posterior medial papillary muscle. So it's like posterior medial papillary muscles and posterior third of the septum and posterior wall of both ventricles. In posterior descending artery, because it supplies posterior medial papillary muscles, so infarction may cause posterior infarction may cause posterior myocardial infarction, papillary rupture, which cause mitral regurg. So if there is a mitral regurg, we should like put posterior descending artery into consideration. Right coronary artery supplies the nodes, SA node, AV node, right ventricle. But that's why if there is an infarction, it will cause nodal dysfunction. Like it will cause bradycardia or even heart block. Right marginal branch from right coronary artery, it's not very important, but it supplies the right ventricle and it can cause right ventricle infarction, so it will cause hypotension, clear lungs, jugular venous distension. It's the same as cardiac. You can say it's like the same as cardiac tamponade. That's the photo from first aid. The dominance, we determine the dominance through the posterior descending artery. Whichever artery gives rise to the posterior descending artery is the dominant side. So here, right dominant circulation, PDA arises from right coronary artery, like PDA from right coronary. Left dominance, so PDA through left coronary. Codominant, PDA arises from both.